You're welcome to Dr. Abayomi Ajayi live. And my name is Dr. Abayomi Ajayi. Yeah, it's a wonderful afternoon, and the weather is so good in Lagos. I don't know where you are. Well, today we're talking about understanding non-invasive prenatal testing, or I prefer even calling it non-invasive prenatal screening. Well, you must agree with me that it's very interesting times to be. Technology is making life so good for everyone. And for us, even the end of the reproductive end, since 2003, when we have been able to, the whole human genome was completed. That is, we are able to map the DNA in each individual. It's possible now to map all the DNA in anybody. And so, one of these applications of this genetics, if you like, or the study of the genes, is this non-invasive prenatal testing. What are they? What do we mean when we talk about non-invasive prenatal testing? These are non-invasive tests, as the name applies, and they are a method of determining the risk that a fetus will be born with certain genetic abnormalities. So, in other words, is to screen for genetic abnormalities in babies that are still in utero. That is, babies, when you're pregnant, you can screen whether the baby is going to have a certain genetic abnormality. And the testing is done by taking your blood sample, and then we are able to look at this DNA. Now, you see, this is very interesting because what we had always known is that DNA is present in the cell, all right? But now we know that there are some small fragments of DNA that are circulating in the blood, especially when a woman is pregnant. And unlike most DNA which are in the nucleus, these are free-floating DNA. They are usually from the placenta of the baby, and therefore they can be taken to be representative of the DNA of the baby. Yes, like I said, they can be taken to be representative. So these are free-floating DNA. So sometimes they are called cell-free DNAs. So sometimes you can see that in some certain literature, cell-free DNA. We're talking about this NIPS or NIPT, whatever how you like it, whether you want to call it non-invasive prenatal testing or you want to call it non-invasive prenatal screening. The screening I like because actually that's what it does. It can only screen. It cannot make a diagnosis. During pregnancy, the mother's bloodstream contains a mix of this cell-free DNA from our own cells and those from the placenta. So you need to understand this, okay? But before we go on, please like and share this video on your timeline so that other people can benefit from it. Because this is also a very new thing. It's very recent that so many people, especially when you're planning to be pregnant, it's important that you have this information. So when a woman is pregnant, she has a mix of cell-free DNA from her own cells and from the placenta of the baby she's carrying. So you understand what that means. That might be one of the things that also might be we might need to work on later on. That means we might even be able to make some diagnosis of the mother in future. But right now we are concentrating more on the one from the placenta. And sometimes this mixes up with the results. What you're actually interpreting is the problem from the mother and not from the baby. Yeah, but that happens once in a while. We know what the placenta is. That is the tissue in the uterus that links the fetus and the mother's blood supply. These cell-free DNAs or the DNA from the fetus are very often used to diagnose chromosomal disorders. You know what chromosomes are? Let's go back. The other time I was talking about this, and I said chromosomes and the gene, they're usually a cause of headache sometimes. All right? The DNA is arranged in chromosomes. All right? And each chromosome we have 23 pairs of chromosomes. 23 from the father, 23 from the mother. So you have 23 pairs, making 46 chromosomes. And the last pair, it's usually the sex chromosome. That's what tells whether you're a boy or a girl. Because if your last chromosome the pair is XY, that means you're a boy. The pair is XX, that means you're a girl. You know. So, but sometimes there are errors in this chromosomal arrangement. You know, the last time I was telling you that if you imagine a bookshelf, that might be difficult for some young people because I don't think bookshelves are in existence anymore now. But imagine a bookshelf and there are 23 shelves on that the bookshelf, but there are 23 compartments, and you put one book in each compartment. Okay, so one book in one book. I mean, a pair of books in each layer. So you have 46 books, but 23 layers. That's what the chromosomes look like. Now, sometimes nature forgets to put one book in a particular layer. For example, let's say layer 3 has only one book instead of a pair. That's an error. Let's say layer 21, for example, now has 3 instead of 2, then that's also an error. All right? So when this happens with the chromosomes, we call this aneuploidy. Aneuploidy, in other words, means that there is an error in the number. So instead of 46, you can have 47, you can have 45. All right? So these are things that NIPT can make a diagnosis of. Now, the commonest chromosomal disorder, which is compatible with life, is called Down syndrome, or aneuploidy chromosome 21. You know what Down syndrome is, okay? The Mongol, you know. We see there's so many now, even in Nigeria, there are bodies that are looking after the welfare of children who have Down syndrome. But what we are saying now is that it's even possible to make a diagnosis of when that woman was pregnant. So we can make a diagnosis that can make you to either prepare to have a special baby or to make some decisions whether you don't even want to have the baby. That is a decision that you will be left to take. But it is not only Down syndrome that can be diagnosed. Edwards syndrome is also another, which is the aneuploidy affecting chromosome 18. And Patau's is aneuploidy affecting chromosome 13. Now also the sex chromosomes. Don't forget I told you the last set of chromosomes, or the 23rd chromosomes, are the sex chromosomes. So also you can, these are the things that you can also see. So whether you like or not, you are going to be able to see the sex of the baby, and you can see whether there are abnormalities with the sex of the baby. I would say a few words on that later on about the sex. Now, Folashade Salah, Olushola, Oloshude, Akimade Busayo, thank you for joining on Facebook. Akirasheda, Ogadimaje, Radia, big ups, Radia, Katie Fresh, Ajoke, Adiemi, thank you for joining on Instagram. Now, so we can also screen for disorders that are caused. Don't forget, let's go back to that shelf again that has 23 compartments. Okay. Now, sometimes it's possible that the 23 pairs are possible, but when you look closely at the books, the book has been chopped off. One of maybe on a particular layer. So that also is a problem. Or so we can say you can have a deletion or duplication. Sometimes even the book, instead of it to be chopped off, is there, but you have the, let's say it's divided into half, it's not chopped off, but you have the replication or duplication of one. So these are things that you can discover from the NIPT test. And that we've done for quite a while. That's where we started from with the NIPT test, looking for chromosomes. But in the chromosomes or in these books are now the genes. The genes are like the print you find in the book. The DNA is what is arranged in chromosomes. You can see it in the books. That's the DNA. Your 23 pairs are how the DNA is arranged in chromosomes. But if you open the book, then you can see what the genes are. Now, that's the new thing now. We are able to also detect some genetic disorders, that is like printing errors or spelling errors in the books by NIPT. That is the new ones now. You know what the implication of this is, that when sometimes nature wants to write car, I don't mean it's car as in car, but it says it's like it wants to write car, and it writes, let's say, CBD. You know that doesn't make, or CBR. That's no longer car. So there's an error. So in other words, there's sometimes that there is a single gene, and what it does is that it continues to repeat. Anywhere it wants to write car, it will write CBR, CBR, CBR. So, and that is like what happens in sickle cell disease. One amino acid is just replaced by another one, and the body continues to replicate that thing. And so we see that in sickle cell disease. And so these diseases are usually called single gene disorders or monogenic disorders. Now it's possible for us also now, because this is now the newest part of non-invasive prenatal testing. It's possible for us to be able to diagnose the gene, especially with single gene disorders, in the baby, in the fetus. Now, why do we call it non-invasive? Because you don't have to touch the baby before you can get the DNA sample. It only requires you drawing blood from the pregnant woman, and you don't pose any risk to the fetus. You know, before now, in order for you to make a diagnosis, you have to go to the baby, either you are taking from the amniotic fluid or you are taking from the chorionic virus, and there is a risk that you can have a miscarriage, there can be infection. But now, we don't need to do that no more. All you just need to do is take the mother's blood, and you are able to get this information. But one thing, I must sound a note of warning that this is a screening test. So it cannot give definitive answer whether or not a fetus has a genetic condition. It can only estimate whether the risk of having certain conditions increased or decreased. Okay? So what the test is going to tell you whether the risk of what you are screening for is increased or decreased, or whether the fetus has any increased risk of any genetic abnormality. Of course, you know that if you're screening for if it's a single gene disorder, that's much easier for you to, the interpretation is much easier. Now, because we're getting the cell-free DNA from the mother, or what we call the fetal DNA, then it must reach a particular level in the mother's blood for you to be able to make a diagnosis. All right? So in order for you to be able to identify chromosomal abnormalities, you need that the pregnancy should have reached about 10 weeks. At this point in time, it is assumed that about the fetal component of the cell-free DNA will be at least 4% of the cell-free DNA. And at that point in time, you can make a diagnosis you can use it to screen for this congenital or genetic diseases. Now, so you can imagine that the results will not be reliable if you do it before 10 weeks. So these are some of the things you need to watch out for. The test cannot be done before 10 weeks. Because at that point in time, the fetal fraction might not have reached the state you want it to reach, or the level you want it to reach. Now, other reasons why there can be low fetal fraction will include sampling errors. This blood sample should be handled like gold. You must follow all the instructions, because once it is messed up, the result will not be reliable. And there is the conditions for keeping it safe, they're not much. So most of the things is at room temperature, but later on the doctor will, because we don't want, at this point in time, we don't just want patients to, either you have to do it through a doctor because some counseling is involved, or through a laboratory that is certified to do it. So, but another problem that can arise is if the mother is obese. It might take a later stage before that critical stage of 4% is reached. So, and then of course when there are fetal abnormalities also. But what do you do when you have a positive test result? Don't forget, I said before the test is done, some counseling needs to be done, all right, to prepare you. Okay, then you will have, if you, what about if the test results say it shows that there is increased risk? The doctor will have taken you through what you might need to do before you even take the test, and what is the implication when he says the risk is decreased. Okay, so don't forget those are the things that you can screen for when you're using NIPT. It is not every genetic abnormality that can be screened for as of now. I told you the chromosomal disorders that can be screened for, and I told you of the single gene disorders that we can screen for. I'm still going to go over some of this list later on. Now, don't forget that it's also a screening test. So, a positive result just means that you will need to do further diagnostic testing. And this is where chorionic villus biopsy or sampling or amniocentesis might still come in. You know what that is. We understand we might have to take a sample from the chorionic villus or amniocentesis to take the fluid surrounding the baby, the amniotic fluid, and to test it to see, to make a diagnosis, a firm diagnosis. Now, why do we then need to do this if we might still have to confirm? Now, it's been seen that about this test reduce your need for this invasive test by about 90%. So NIPT is able to reduce your risk that you can face from doing either chorionic villus sampling or amniocentesis by about 90%. Now, if you have a negative test or the test shows that the risk of the fetus having a genetic problem is low, you can still, if you like, do a first trimester scanning. The good thing is that whether it's positive or negative, all these results come, you do them about the same time, between the 10th and the 13th week, so that this can give you the opportunity to take decisions if you need to take decisions. How is this test done? I've said that before. You go to the doctor or your laboratory and you have your blood test taken. Only about 10 minutes of blood sample is required for you to get the result, and in about 1 week your result is back. If you need to do chorionic villus sample, then this is also done about the same time, 11 to 13 weeks. That's normally when you do it. Now, but who should do NIPT? Who are the candidates that should do this test? This is evolving. When we first started, we looked at people who have the risk factors. Okay, women above 35 years. If you have a family history of a genetic disease, or if you have had a child that has been affected before, then definitely you're a candidate for doing this test. But right now, the American College of Obstetrics and Gynecology has just said, look, this test is for all women, because sometimes this comes from the blues. Some of these things, everything seems to be okay. A 30-year-old woman might be pregnant, and then the husband is 32, and she comes up with a baby that has Down syndrome. And the good thing about this, because it's no longer, it's not an invasive disease, and the accuracy for the 3 most common diseases, chromosomal diseases, is about 97 to 99%. So it's really a very good screening test. You know, but the questions many people ask, especially in this environment, that, oh, wait a minute, genetic diseases are not common in this environment. And so when I hear that, sometimes I just laugh, because there is no reason why we will not have genetic diseases. Because human beings, whether you're black, whether you're white, whether you're Nigerian, you're American, you're anything, when you are caught, it's blood that comes out. So we have the same way that there can be chromosomal errors in anybody, same way that there can be chromosomal errors in us. The problem is that most of the time we're not looking for it. Most of the time there are some other problems that we're facing that is not making us to see those things. But you know what? These things are here with us, and we can see that when you go out in the streets, you can see children with Down syndrome. The other thing is that some of the other chromosomal abnormalities, they are not compatible with life. For example, very severe Igor syndrome or Patau syndrome, the babies might just be born and they die very soon. and most of the time, or they even die in the mother's uterus. And sometimes we blame the doctors and say the doctors are not good, they are not good. I was at the antenatal clinic last week. I just came back this week, and then the baby is no longer moving, and the doctor did not find out what this is all about. Sometimes it's because of these chromosomal problems, especially those ones that are not compatible with life. So nature has a way of taking care of such. Now, but some are compatible with life, and like I said earlier on, the commonest chromosomal abnormality that's compatible with life is Down syndrome, and that's why you see a lot. You see some children with Down syndrome, and we are getting more and more aware in this environment about that. So this test can help us to prevent such things, or maybe not completely prevent, but can make us to make a diagnosis on time. You make your diagnosis about 11 to 13 weeks, and you can make your decision whether you want to prepare for that baby. For example, also, some of them might have heart diseases. You might want immediately to know you are preparing for maybe heart surgery or whatever you're going to do. So you can have a good understanding of what is to come. Now, like I said, other chromosomal errors like trisomy 18 or Edwards or trisomy 13 or Bartels, but also there is the sex chromosomes. Sometimes some people have what we call Turner syndrome, in which I told you the 23rd pair, the sex chromosome. So instead of them to have XY or XX, they have X one side and the second side is missing. So we call them XO. These are people who normally are infertile. They might not be able to have children because the ovaries might not function properly. And then also the men, also there is a variant in men where they have an extra X chromosome. A man should have XY, which makes it 46. But they now have 47. They have XXY. Such men also have infertility, and they might not be producing sperm. But if you can catch it early also, it's possible. So, we did a test, we did a study, and we found that in this environment, we looked at over 3,000 sperm samples. We found that about 12% of them had no sperm at all. One interesting thing would be to look at which of these people also have this condition of it's usually called Klinefelter syndrome. But that is with the chromosomes. And we've talked also about the single gene disorders now that we can screen for. Like these are rare, but they appear in millions of people worldwide. And now over 10,000 diseases are caused by a single gene error. So, and there are so many diseases that I told you it's about over 10,000, but the common ones are, especially in this environment, will be sickle cell disorder. But there are other things in other environments, and the funny thing is that these monogenic disorders or single gene disorders account for about 40% of admissions in pediatric wards. So they carry a lot of burden, especially for the children. You know what it looks like when a child has sickle cell anemia. But other things that are single cell disorders, single gene disorders include thalassemia, hemophilia, cystic fibrosis, which is very common among the Caucasians, and fragile X syndrome, and some other things. So you will see now that, like I said, the application of this NIPT is fast expanding, and it's going to get to a stage also that also, and it has happened, where sometimes you detect some funny cells in the blood sample that also belong to that are from the mother. For example, it's been seen that there has been a time that some cells were seen, some cancer cells were seen, and that was the first way that they knew that the mother was developing early cancer. And so there's so many things that is opening up in this channel, and what I'm just going to say is watch this space. So when it comes to NIPT, I think it's something we need to think much more about, and then we'll see how this progresses. Yes, I have an Instagram question which I'm not going to answer because this is not related to what we're discussing. We will answer the question. Just watch your time, the time that you answer it there. So what we're talking about today is about non-invasive prenatal testing. I know it's a little bit difficult because it's a new thing, and but it's something that we need to understand and something that we need to be able to use because there's no point in you having something that people don't even know what is useful. So, and that's why I thought it might be a good thing for us to talk about it, and we continue to talk about it until you really understand what it can be used for. And the good thing is now, the last time I did this topic, it was not possible to screen for sickle cell disorder or sickle cell anemia with this test, but now it is possible. So for people, we are not encouraging AS people to marry, but if they do, it's also possible for you to screen for the baby this way using NIPT by just collecting mother's blood. And one bonus also that you get from the NIPT test is that you can always determine the gender of your baby FOC. Thank you very much for watching. We'll see you in